What's up, everybody? It's Steve the Hurricane here right now, and it is 5 o'clock Eastern time. And to get through this webinar for you, we are going to have a latte, the espresso. You see how tiny this is? Look at my big old giant hands, right? And this little tiny cup. So I'm going to have this with you at the start of this webinar here because I'm excited for this webinar. I'm fired up for this webinar. I'm looking forward to going over the home care evolution and talking about what this is for you, talking about the industry, the state of where things are, and really how to get out of this situation. Why am I talking about getting out of the situation? Because the situation we're in, let's be real, it sucks, all right? And I say that very truly. What do I mean by it sucks? We have not enough caregivers. Cost of doing business is high. Inflation is through the roof. We have to charge more to pay more, and there's all this other stuff. But how do we do all of this, right? And it's a challenge, and people are burning out, and people are tired, and you know the pandemic the last 2 years, and it just seems to just continue on, and you know all this other stuff that we got to deal with. So I know running your business right now is hard. I know it's a challenge. I know you got a lot of things that you're facing. You're spending an hour with me. I'm going to promise to give you everything that you need so you can be able to get the most out of this. So I'm going to sip this real quick as we get started here, because I like to start right on time. It's 5:01. You're here with me. I don't want to waste time. I want to get right down to the meat and potatoes with it. And for those of you that don't know me, I'll introduce myself in a second. This might be your first time meeting, but what the freak? This guy is having an espresso shot to kick off his meeting. I've been going all day. I've been going all day, right? But I love what I do, and helping people grow their businesses is my passion. And so I'm honored, and it's a privilege to be able to serve you, to be able to be here with you, and just work with you like this right now. So let me shoot this real quick. Maybe not too quick when it's real hot. Woo! I had a tongue. I don't have it anymore. It's gone. I'll come back to that in a second. Anyway, let me go ahead and share my computer screen for you here. Steve the Hurricane, and this is my home office. This is a reel on here, 6-foot Hurricane, as you can see right behind me. So again, I love what I do, and I'm honored to be able to be here. And so as you see on the screen right now, this is the home care evolution. And let me go ahead and start the slideshow for everybody, folks. Let's make this happen. So this is what we're going to go through. I'm showing you the wrong part of it. Let's swap that. Ta-da! Now you see that, and I see up here. All right, so again, this is the home care evolution, and I'm excited to be going through this with you because, again, it's all about adapting and transforming our businesses, which is something that I'm honored to say for the last 10 years now, I've been able to do for hundreds of agencies all around the planet. And we've helped our clients grow their revenues to over $1 billion more than what they would be able to do without us. That's a B, yes, over $1 billion in the last 10 years with everything that I do at my company, Hurricane Marketing Enterprises. It's an honor and a privilege. And so this is what we're going to tackle. We're going to just tackle this, right? We're going to tackle this over the next 45 minutes or so. And I'm going to go through what is the home care evolution. We're going to talk about what are the factors that are behind it. I'm going to pull up a lot of information. You see me right here. I'm holding up the 13th annual Home Care Pulse Report. What I love about the Home Care Pulse Report is they collect data from so many sources. I'm going to pull through not all of the slides, but a couple of really key important ones that kind of paint the picture of our industry that's really not a great picture, but how can we overcome it? Because, like, you know, what are the factors? Then after the factors, well, what does this mean for me and my agency? I own the agency. You know, I've been in business for 10 years. I've never seen a climate like this. I've never seen the challenges that we're facing. So what does this mean for me and for my agency? Then what does it mean for my patients? And I got some sad news on that, because really at the end of the day, something that I am very passionate about, and I don't want to get political because I honestly don't care about the Democrat Party or the Republican Party, all right? What I care about is people. And what I know is that both the Democrat Party and the Republican Party don't care about seniors, all right? They don't care about the seniors. Our government needs to do better. They're not doing better. So when it comes time to vote, we need to vote for people who are going to actually do something about the care for the people of this country, especially the people who work their whole life to provide and put income and be taxed and everything else. We need to take better care of our people. The government needs to do that. But in the meantime, what does this mean for my agency? What does it mean for the patients? And then what does it mean for the next 5 to 10 years as an industry as a whole? And what can I do right now, today, to get started in making this transition and evolving my home care business so that I can thrive for the next 10 years. And this is going to be a positive one, I promise. I'm going to keep it positive. I know I'm giving a little bit of a negative mojo here, and that's okay. But actually, he just made an espresso too. I love when you guys interact with me. You put these questions out here and you share this stuff with me. I'm so glad that you had the espresso. It's the end of the day. Single shot espresso. It's good. I'm getting ready. I'm going to Italy in 2 months with my family. We're going to have a great time. So I got to learn some Italian, and I'm already a fan of espresso. I think I'm going to fit right in. Okay. So anyway, for those of you that don't know who I am, and obviously, as you can tell, I like to have a good time and enjoy myself, right? And I don't know how I jumped ahead so fast, but this is me. Oh, stop. There we go. Okay, so this is me and my family, all right? So the top corner here on the left-hand side, that's my beautiful wife, Susan. If I am Steve the Hurricane, she is definitely the eye of my storm. All that I am revolves around her. We just celebrated our 13th wedding anniversary on May 1st of this year. Mother's Day was great on Sunday, and we have a great life. And we are very, very blessed and honored and humbled to be able to give God all the glory for everything that we have in our life, because we really don't have any issues or problems. She is my rock, all right? The picture to the middle on top, yes, I have my logo tattooed on my shoulder. It was a 40th birthday present that I bought for myself. I've always wanted to do it. I have a scorpion on this side that I've had since I was 25 years old. I added my logo and my kid's name over here on my left arm. And I just love it. It's great. I am Steve the Hurricane. I've been Steve the Hurricane since 2005. So I might as well just take that name, run with it. It's a registered trademark. Everything that I am, my entire brand is around this. So even long after I'm finished doing what I currently do for a living, I will always have this as part of my life. So that's why I got that tattoo. To the top right of the screen, you see my favorite person in the world. That's my dog. His name is Kit Kat. He is a long-haired Chihuahua. He's about this big. He's sitting on my lap. That's him on his 3rd birthday. We took him out on the boat with us down in Florida, and we docked at a restaurant, and they gave him a plate of bacon as his birthday present. And it was a great day. And again, that little guy, he is just like the bundle of joy that it brings so much energy and happiness to my household every single moment of every single day. Underneath him are my 3 children, Stephen. In the middle is Sienna, and to the right is Sydney. Stephen's the oldest, Sydney is the middle child, and Sienna is the baby. And they are truly little hurricanes. They keep us going. This is who I am. My wife, Susan, and I in the middle. I love boating. It was the best decision I ever made, was to get my boating license. I joined a boat club, so I have access to boats all around the country. Some of my Elite Academy clients are in town. They just arrived, and I'm meeting with them tomorrow and the next day. And on Friday, I'm taking them out on the intercoastal here off the shores of New Jersey. We're going to have a blast. And then last picture is the fitness photo I did. I'm a fitness buff. I maintain around a 17–18% body fat. I keep myself active. I like to lift weights, right? So I hope you're enjoying. I hope you're ready for an action-packed event. And ultimately, what do? I help people scale and grow their home care businesses. Yes, that is what I do. This picture right here was me at my last conference boot camp that I had in November of last year, and that was the Home Care Millionaires Boot Camp. We had about 150, 160 people in attendance, all business owners. Help them to be able to prepare for what was coming in 2022 and be able to move forward. And that gives me an opportunity to let you know that the next one, our 10-year anniversary, is coming up June 22nd through the 24th this year. It's at Newark Airport Hotel. So the Newark Airport Hotel is one of the New York City airports. There's actually 3 of them. And you fly into it. You don't even have to leave the airport. The Marriott Hotel is right there. And then I'm telling people come in and stay the weekend because it ends on a Friday afternoon. Go see a play. Go have a world-class meal. Go see all of the sites that New York City has to offer. It really is the greatest city in the world. And I'm going to give everything you need to adapt your business to the changing circumstances so that you can thrive for many, many years to come. That's the whole purpose of it. And that's why we're here. Adapt, transform, and thrive with the Home Care Evolution Conference. All new content. If you've been to a boot camp, you want to come to this. If you've never been to a boot camp, you need to come to this. It's going to be amazing. I'll have a free giveaway for anybody who wants to take action on that at the very end. I'll announce it. I'm actually going to give you a whole bunch of stuff for free if you decide to move forward. So now let's go into the first topic here, right? Like, what is the home care evolution, right? What is the home care evolution? And basically this evolution, the reason why I changed my company's name from Home Care Marketing by Hurricane Marketing Enterprises to Home Care Evolution by Hurricane Marketing Enterprises is because of the fact that there's a huge industry shift. When the home care industry first got started, like 30, 40 years ago by, I want to say, Alan Hager from Right at Home and the former head of Home Instead, they were like two of the largest business entrepreneurial type individuals to start a home care agency in the 80s, right? And there were a couple other people that did it. And the whole focus was providing excellent care so that people can stay home. And it was all around the patient focus and patient care model. Fast forward 40 plus years later, and now all of a sudden there's a shift. Like we are taking care of our patients. We want to take care of our patients, but we can't just make that the primary focus of what we do anymore because we got a million challenges that we're dealing with. You heard me talk about this at the very beginning. We can't get enough caregivers. When we get caregivers, we can't keep caregivers. It seems as if nobody wants to work anymore. We can get patients, but when we are constantly sending new people into the patients' houses because we can't keep the caregivers, we lose the patients, and it's like, it's almost like you're spinning our wheels. As a result, other challenges have led to office staff turnover, where people are leaving the industry, and I don't want to be a scheduler anymore. I don't want to be a recruiter anymore. It's hard to market. It's hard to be able to take on new business. As a marketer, I see marketers who are bringing in referrals. We can't staff it, and that deflates them, and then they end up quitting and leaving too. So there's a lot of challenges that we're dealing with. And so the evolution, the home care evolution, and what I spend the majority of every single day training my clients how to do is to shift from patient first to caregiver first. Now, hear me out on this. It is creating a business model around caregiver focused first. Create the best retention strategies. Have the highest pay in the market. Unfortunately, charge the most to be able to require that. When you're paying the most in the market, that makes it easier to attract caregivers. Now, stay with me. When we attract the caregivers, now it changes the way you manage them. Right now, today, the challenges. One of the challenges is we, as a business owner, are literally begging caregivers to go to work. We are begging them to take care of patients. We are begging them to come in and work for us. When you create the best environment, work environment, meaning the best company culture, the best programs, benefits, training, and compensation, now all of a sudden you become the agency that everyone wants to work for, or everyone who is working wants to work for. You then attract people to you, and then you hire the best people, all with experience. And now, instead of begging people to go to work like we currently are, we take these folks and we give them a higher set of standards. And if someone doesn't want to follow those standards, whereas in today's economy, it's like, please go to work. Oh, I can't do this, I can't do that, whatever. And you bend over backwards to get them to take the case. Now it's, you don't want to take the case, Fine. Go work somewhere else where you're not going to get this culture, you're not going to get this compensation, you're not going to get all these things that we've created because you have 100 other people that want everything that you've created. As a result of that, now all of a sudden you get to actually be the employer again, and there are consequences for bad performance and rewards for good performance, such as advancement opportunities, which is a whole other thing that I don't have time to get into today, but these are all part of the culture and what you're creating with this evolution. And what is the result? The result is you have better caregivers, better support for those caregivers, which ultimately leads you to providing a superior outcome for your patients. I want you to write this down, everybody. The shift, the evolution, we are a recruiting firm that specializes in private duty home care. Write that down again. We are a recruiting firm that specializes in private duty home care. When we do this shift, and it sounds amazing, and don't worry, I have plenty of testimonies to go through and share with you, right? Because I have people who are all around the country living exactly what I'm saying. They're charging what they need to. They're creating this culture. They've evolved and transformed their business. And as a result, they've doubled and tripled their annual revenue over the last 12 months. And they're taking care of more patients now than they've ever taken care of before. And they're not dealing with the headaches that 90% of agencies do. This is the home care evolution. Caregiver focus first. Gives you the authority to run your business the way that you should be running your business so that you can provide the superior service that these patients need. That's the home care evolution. Now, moving forward, right, I get passionate here, and I know you can tell my passion. What are the factors behind this evolution? Like, what are the factors that exist out there? So let's take a look at some of these things. All right, you see on the screen right here, profit loss statement. This is the first one, right? And this is where, like, it makes me feel sorry for the industry as a whole, because again, this is a home care pulse benchmark study. If you need the home care pulse and you want to pick up the report, you can actually pick it up and get, I think it's a 15% discount. And you can go to Home Care Pulse and use Evolution 22, Evolution 22, all capital letters. That's my discount code, and they'll give you 15% off or 20% off, and you can get the Home Care Pulse report for all of the data. But what I love about this data is any agency who's registered with Home Care Pulse, who's filling out that report, I'm going to say that they're a better agency than ones that don't keep accurate data and don't fill out this report information every year. There's over 1,000 locations in the United States that have participated in this survey. So these are really the cream of the crop of the industry. And so when you look at this profit loss statement, what does this say? Like, this is one of the factors that's creating this paradigm shift and this evolution and how we have to adapt and transform to be able to thrive for the next 10 years to come. You see these categories all the way to the right. You have the people who are either brand new in business or they haven't broken $1 million in revenue yet. Then you have the next category over to the left are people who are doing about $1 million to $1.5 million. Then you have the next category over where it's about $1.5 million to $3 million. Then you move over one left and it's like $3 million to $5 million. And then you move over to the last column, the purple column, and those are the masters. And the masters are all people doing over $5 million in revenue. They've mastered this business. They've mastered this industry. Now, as you're looking at this P&L statement, you see the median average revenue for each of those subcategories. And let's just take a look at the middle category here, because that's like right in the middle of every number that's up there. About $2,100,000, the average agency, middle of the pack agency that filled out this report here. And when you go down and you see all of the direct care expenses for caregivers, and you start adding it up, and it's their wages, it's their insurance, it's their liability, and all the stuff that goes into it. All of that right there comes out to 62, and let me get my calculator so I can add this up with you, 62.2%. Next category down is all things it takes to recruit and retain caregivers. All of this culture building that I'm talking about, there's a cost associated with that. All of the ads that we have to place, and the SEO, and the salaries of the people who have to do the work, all that factored in there, that's 3.3. So now if you're following me, that puts you at 65.5% revenue of what you spend goes towards the caregivers and all things acquiring caregivers. Moving forward to sales and marketing, and I've been saying this for years, sales and marketing, you should spend approximately 5% of the total revenue that you're trying to generate on all things sales and marketing. Marketing rep salary, lunches, sponsoring activities and events, going to taking people out for coffee, your SEO on your website, pay-per-click ads, everything about 5%. And what does it say right there? Is that 4.6? Yep. So plus 4.6%, that puts me at 70.1%. And then last but not least, on the very bottom, that's everything else. That's my software. If I'm part of a franchise, my royalties, my rent, my utilities, my telephone, and all the stuff I have to do in there, travel for this and that, meals, expenses, office staff, salaries, everything included except for the owner's salary. Everything in there you see, it tells you everything but the owner's salary, and that comes out to 22.7%. So when I add that up, let me do it again. I cleared it out by accident. So 62.2 plus 3.3 plus 4.6 plus 22.7. That's 92.8 or 93%. That means a $2,100,000 business spends $1,950,000+ to operate, leaving the business owner with just shy of $150,000. And I'm sorry, on a $2 million a year business, $150,000 left over as profit, and that's all you take for yourself, there's something majorly wrong. That means that if you only have 7% profit, like go to college, like Business 101. If you look at Business 101 or Business Economics 101, one of the first things they'll teach you is a business that is a for-profit business should be operating 20 to 25% profit. 20 to 25%, meaning if you're part of a franchise, you should be 20, 21, 22% because you got that royalty. If you're not part of a franchise, you should be 23, 24, 25% profit because you don't have that royalty. So this is a big problem when I look at the industry average, even the masters. If you look over at the masters and you add up all of their columns, these are the people who are the best of the best, and they still are only operating at about a 14% profit margin. Why is the margin so low? This is a factor that's causing this change, because if we don't make the adjustment, if we don't adapt to this change, we can't give raises to our staff. We don't give raises to our staff, and I'll tell you right now, you can write this down, you can quote me on this. Nothing hurts a home care business's growth more than office staff turnover. You think caregivers is the hardest thing? No, it's keeping your staff. If you lose your office staff, forget about caregivers, because you're constantly changing the staff, which means there's no real management and oversight, so you're constantly changing them, and people get hurt when that happens. Right? So you have to understand what I'm saying here. This is very, very important. And again, people who fill out this home care pulse report are more savvy business owners than most who don't fill it out. So it's even worse for those who aren't keeping accurate statistics and data out there, and they're just flying by the seat of their pants. This is one of those factors that I'm talking about. Here's another factor that you see, right? 85% of the agencies in the country have turned away business because they can't staff a case. 85%. That is literally 17 out of 20 agencies. So every 20 agencies, 17 have turned away a case, and it gets worse, where 60% of the agencies have done it consistently, meaning that there's nothing they can do about it. They are constantly, week in and week out, turning away business. This is a major problem, all right? Now, don't worry. We're going to turn things around. Now let's take a look at the recruitment. Like, all right, well, what are we doing to get caregivers? All right, so we're all well aware of the problem. Well, look at the number 1 and 2 places for recruiting caregivers. You have Indeed.com as number one, where almost 40% or 2 out of every 5 caregivers that you've hired came from Indeed.com. You're all well aware of that. The second one down is current employees through your referral bonus program. And I'm actually very happy to see it. It makes me very happy to see that the number 2 referral source for getting caregivers is people who currently work for you referring their friends. So keep going with that, all right? And then you see all the other ones on here, and it kind of trickles down, leading to the top 10 best referral sources for caregivers. But I want you to understand this data here, because this is why the evolution is so important. So moving on to the next slide here, this is what it cost us to get one caregiver from the top 5 sources. So a caregiver from the employee referral bonus program, and I'm not sure how they came with that data, because I don't know anybody who's paying $837 for one referral. The only thing I'm thinking is that number is so high because they're also including the recruiter and the office staff salary, a portion of it, promoting and reminding caregivers that we have this program. And so the time that people spend promoting and advertising it is factored into it. And so therefore, with how much effort we put into it and how few people we actually get, it comes out to about $837 per caregiver recruited that way. All right, now to numbers that make more sense that we can really understand. Indeed is exactly it. We know for all the money we spend to Indeed, approximately $561 is what it costs us to get one caregiver. And it's not one applicant. All of these, it's not one applicant. It's actually an applicant who's been interviewed, who's come in for orientation and actually started working for you, right? So it's that whole onboarding process through the day they started actually working for you. That's the cost associated with all of these numbers here. My CNA Jobs. I'm a big fan and friend of Brandy Kritaika, who's the owner of My CNA Jobs. We go way back to 2012 when we both first got started. $440. Social media, Facebook, LinkedIn, Twitter, etc. $363. And then you have word of mouth, which is $167. And that's by, again, we talked about culture and the evolution, right? So we're going to touch on that. We're going to come back in a minute. I want you to take a look at this. And these are things that you should calculate. By the way, so you see these numbers here? I hope you wrote them down. I hope you took a picture. I hope you're taking notes. Write them down and then go calculate how much you're spending on all of these. Because it's good to see where does my agency stand up, measure up against the rest of the industry, right? That makes sense. Am I outperforming the industry? Hope so. If I'm not, I need to make some changes because I should have at least these numbers. If I'm worse than these numbers, we got to do some things differently internally. Okay, good for self-evaluation. Let me go back a slide. I went too far, right? So, oh yeah, let's use Indeed. So let's just say Indeed is $500 to get a caregiver. So that means that this year, or $550, if I want to hire 100 caregivers in the next 12 months at $550 per caregiver, which is pretty much what the figure is, that means I have to spend $55,000 or budget $55,000 to pay to Indeed to be able to get 100 caregivers. That's how the math works out. $550 a caregiver, 100 caregivers, $55,000. Now I want to talk about turnover rates, because this is where, again, working smarter, not harder, really comes into play. So as you look at the top turnover sources, turnover numbers for the top 5 sources for recruitment, Indeed.com is a staggering 85%. 85% for Indeed.com, whereas when I look at ones that have to do with culture and putting the caregiver first and taking care of caregivers, Employee Referral Bonus Program has a 30% turnover rate, and word of mouth, having a reputation as being a good employer, has a 25% turnover ratio. So it's real interesting when I look at it. So it's like, all right, well, I put $55,000 to Indeed. So let's just stay with that for a second. If you put $55,000 to Indeed, you will hire 100 caregivers. But 12 months from now, May of 2023, you will lose 85 of those 100 caregivers that you hired. So you spent $55,000 to get just 15 long-term caregivers for your agency. And this is a problem because when you do the math, that means that you're actually spending $3,600 to get 15 or per long-term caregiver. 15 long-term caregivers, $55,000. That's a huge expense to the bottom line. Now let's take a look at the referral bonus program. Same situation. If I want to hire 100 caregivers, and we already talked about how it's about $800 per caregiver. 100 caregivers is going to cost me $80,000. But it's only a 30% turnover ratio. This is industry standards. Calculate your own numbers to figure it out. That same $80,000, 1 year from now, I'm still going to have 70 of those caregivers working for me. And 70 caregivers can take care of a heck of a lot more patients than 15, which means my business is probably doing much better than the industry that went, or the agency that went with Indeed as their primary referral source, right? This comes out to a much better $1,150 per long-term caregiver. You see how that works? And it's interesting because I read an article that came out recently where Todd Austin, who's a good friend of mine, we were actually supposed to have a call today, and I had to reschedule the call. He was busy, I was busy. I got my clients, like I said, coming in from all over the country to spend some time with me, members of the Elite Academy, and so I had to reschedule the call. But when he and I were speaking and I saw this article that was written where it quoted him, he was saying that the future of home care, and this is the evolution, right? The future of home care is going to be built around caregiver focused. And the agencies that take the best care of their caregivers, that have the best company culture, are going to be the ones that attract more people who want to work for them. So I'm not just saying that this is the best choice, but the numbers do make sense. When you're hiring caregivers, we have to take into consider attrition rate. And if I'm constantly hiring and I'm just churning and burning and I'm losing all my caregivers in the first 90 days, what am I really doing? I'm just wasting my time and my money. But in this case here, I'd rather pay a couple dollars more for people who will be around long term. This is working smarter, not harder. This is truly an evolutionary process. So now moving forward to the next question. All right. So, all right, Steve, this makes sense. All right. So, it totally makes sense. Caregivers who come to me because we take good care of people. People want to refer their friends. We have a good reputation. Those caregivers will always work better than somebody who came from the internet because they don't really have any ties or any reason to stay for us. I'm buying into what you're saying. This makes sense. All right. So now, but what does this mean for me and my agency? Because those are industry stats. What does it mean for me and my agency? All right. So here's the first thing. All right. And you heard me say this before. It means we have to pay more. All right, I want you to know this. I recently shared an article on LinkedIn. For those of you who follow me on LinkedIn, you'll see it, where I just saw this last month. Verizon, the telephone company, Verizon, they have raised their minimum wage for all workers coming in and people who currently work for them to $20 an hour. $20 an hour. And this is where we have to, this is the evolution, right? The world is changing, all right? Verizon is paying $20 an hour. 3 weeks ago, the week after Easter, my kids are off of school. I took a week off. I went to Six Flags Great Adventure. That's the Six Flags that's about a couple miles from my house, where we're Diamond Elite members. We get all those great perks and stuff. My kids love going in there. They're short staffed. Do you know what the starting wage is for people coming into Great Adventure, which is an entry-level position with no experience? $20 an hour. I go to restaurants, took my wife out on Sunday to a high-end restaurant with my family. We had a great time. It was wonderful. They're short-staffed. They're starting people at $20 an hour. Amazon starts people at $20 an hour. Walmart. I mean, I saw a sign the other day for truck drivers. Now, granted, you have to go get a CDL license. But truck drivers, no experience, starting salary $96,000 a year. We have to keep pace. This is our actual competition. I even posted an article this morning. Nationwide data from 2021, the information was a year old in there, and I was like, I would love to see what the current numbers are, but the current data hasn't been accumulated yet. The data was published in May of 2021. At the hospitals, CNAs nationwide average almost $36,000 a year, which is just over $17 an hour. At hospitals last May, I can guarantee you that number has gone up nationwide as an average. That's our competition, folks. This is why it's so hard to get caregivers. I keep mentioning this because the Home Care Pulse report, when I looked at national averages of wages, the national average of wages for caregivers is like $14. So we're not keeping up with the rest of the country and other industries for entry level. This is why it's so hard. So we have to pay more, but I'm not going to leave you hanging. Here's how we have to do it. We have to get very strategic and calculated in what we do. And look at this information right here, right? What does this mean for me and my agency? Look at the difference in retention from the agencies that are in the top 25 percentile of paying people versus the ones who are on the bottom 25%. It's almost a 20% difference. So think about it this way, because you're looking at the numbers like, all right, what does that mean? The people who are paying the least, for every 5 caregivers they hire, 4 quit and leave them. On the flip side, for the people who are paying the most, for every 5 caregivers they hire, only 3 leave them and they're still left with 2. That's literally twice as many caregivers stay with you when you're paying in the top 25th percentile. So in this case here, money truly does talk. Now I know what this means, right? This is going to make it harder for us to be able to attract clients. It makes it harder for people to afford services. This is why you heard me say when it comes to voting in December or November, I don't care what party someone is from, who's the person who's going to do more for our patients, because we all see it every single day. I don't care about anything else that's happening. Who's going to take care of the people of this country? Because we have the baby boom generation, which is the largest population. We're not doing enough to take care of them, and if we don't take care of it, we're going to be in trouble. Now, what does this mean for us private pay folks, right? In the meantime, while the government figures out what they're going to do, we have to adjust, we have to adapt, we have to transform, we have to evolve. So we have to charge more to give these wages so that the business can grow and thrive and be taken care of. And think about what I said with that profit margin. Forget the owner keeping all this money for themselves. You have to think about it from the other side of the coin. If this business is only operating at 7% profit and something happens, they get sued, something catastrophic, unexpected happens, and all of a sudden that 7% profit margin disappears, every single patient, every single caregiver, all of those staff members are all unemployed, all without care, all have to start over and find somewhere else to do it. Everybody loses. So it's not a greed thing as much as it's a long-term sustainability. If the business cannot sustain, the business must survive to take care of all the people you're taking care of. And I don't care if you're taking care of 20 patients, 50 patients, 200 patients. I have my largest client that I'm currently working with is taking care of 1,700 patients right now in their census. 1,700 patients on their client census, all right? They cover the whole state and they're expanding into a new state. 1,700 patients. If that agency goes out of business, everybody loses. That's why we have, this is out of necessity. And I want you to write this down. If you've ever been to a conference or a boot camp or anything, I have said this more times in the last 10 years than any other single phrase. Referrals equals freedom. Write that down. Referrals equals freedom. I'm going to ask you to say this out loud, and I want to hear you in New Jersey. Referrals equals what? Freedom. That's right. Referrals equals freedom. The more referrals I have coming into my agency, the more freedom I have on how I run my agency. Not every single person who contacts us is going to be our customer. Just like at my company, Hurricane Marketing Enterprises, I will tell you right now, there is nothing that I offer that is cheap. But I will tell you right now, a good product isn't cheap, and a cheap product isn't good. And you all know what I'm talking about. It doesn't matter what it is. You underpay people, they're going to do bad service, they're going to deliver an inferior service to your clients, and people are going to get hurt. You pay people well, you hold them to high standards, you're going to charge people more, but you're going to deliver a superior product. And when I'm talking about hiring caregivers with experience, right? So now we take this to the next step. Referrals equals freedom. All right, but who is our actual customer? And this is where we have to refine the target customer. Not every patient out there is a target customer. For those of you who own Medicaid agencies, there's nothing you can really do about the Medicaid. A big part of what I do for Medicaid agencies when I work with them or when they come to my conferences and stuff is I teach them how to add private pay to it so that you can get a blend. You can have all your new caregivers with no experience take care of the Medicaid patients. Once they have a year or two experience and they know what they're doing and their Medicaid patients discontinue for whatever reason, you promote them to a private pay where you have the ability to give them a raise. That's evolving your business. That's part of what I do. And you refine and build the other side of your private pay business to offset the challenges that you have on the Medicaid. For people who are all private pay, you focus around the new refined target customer. I want you to realize this, 100% of seniors, 40% of seniors are on Medicaid, and we have Medicaid programs for those individuals. The next 40% of folks really aren't the target customer. All right, they have some resources, but they really can't afford this. This is why caring.com, care.com, and other direct hire websites and that model works for those folks because they can't afford $35, $30, $40 or more an hour for services, but they can pay a caregiver directly $20, $25 an hour, and they can get some level of care. It's not perfect. It's not as good as going with an agency. There will be times where because they're paying one person directly, the person may not show up and they may be without. But that is something that is in place for that bracket. The last is the top bracket, the top 20%. These are folks who have the resources, who can afford it, and this is the target customer. And I've been saying this for about 5 years now. It is a nerd. A nerd is a four-part customer. I want you to write it down vertically, just like that, nerd, N-E-R-D. Write it out. Need, elderly, resources, disabled, and/or dementia. The need, next to need, please write equals 5 or more chronic conditions. 5 or more chronic conditions. A person who has 5 or more chronic conditions is constantly in and out of the hospital. A person who has 5 or more chronic conditions, they're on at least a dozen different medications. A person who has 5 or more chronic conditions, that is a total care situation. They're not thinking about getting home care. They're not thinking about care options. They will get the care because they have to get the care because they need more than what the Medicare benefit will cover. That's the first part of it. Second part, self-explanatory, equals 65 plus. Nothing else to say there. Resources, self-explanatory, equals money, dollar signs, right? That's why I said this is the top 20%. And then the last part, though, is disabled and/or dementia. And this is where I was just talking to a bunch of my students a little while ago in one of my classes around 12 noon earlier today, the Fast Start course. I was talking about, think about an assisted living. In assisted living, when they bring somebody in, they don't bring somebody in for a couple of weeks or a couple of months. Their goal is to bring somebody in, and the average lifespan of a patient who's in an assisted living is 7 years. Now, we all know an assisted living on average around the country is about $6,000 a month. Some markets, like where I am in New Jersey here, it's closer to $8,000 or $9,000. In other markets, it's closer to like $5,000, maybe $4,000. But the national average is around $6,000 a month, which means you're talking about $72,000 a year. So if the average patient is in an assisted living for 7 years at $72,000 per year, you're talking about almost $500,000 that this resident is going to pay the assisted living for care over 7 years' time. So when you think about it from that perspective, I want people who are disabled and or have dementia, because people who are disabled permanently, they're going to need help for the rest of their life. People who have dementia, dementia is incurable. You can slow the progression, maybe even halt the progression, but you can't reverse it and cure it. That's someone who's going to need help for the rest of their life. So if I have an abundance, referrals equals freedom. If I have an abundance of these type of clients contacting me for services, I can then take care of the ones who reach out to me. They understand this is the price. And I want you to write down, make a bracket next to the other side of nerd. And I want you to put nerds equal high expectations. Write that down. Nerds equal high expectations. Someone with a great need, who's elderly, who has the resources, and they're permanently disabled, and they're paying you for services. I don't care if it's $25 an hour, $30 an hour, $35, even $40 an hour. That person will have high expectations of you and your agency. The way that I train people is give them and meet and exceed their high expectations. And you have to pay for it. It goes hand in hand. And that makes it easier to attract the caregivers, manage the caregivers, hold them accountable to providing that superior quality. You're not hiring somebody right out of school, like I said. At the top dollar price and the top dollar culture and the top dollar benefits and perks of the job and advancement opportunities and everything else, you're hiring people with 2 or 3 years experience. And I have a ton of clients who are hiring people with at least 2 to 3 years experience, and they're compensating them, and then they go in on these nerd clients and they blow away their expectations. Literally blow away their expectations. They walk in, bedbound patient, no problem. Know exactly what to do. You don't get the call outs. You don't get the no-shows. You get the happy, satisfied customer whose family members are calling you in tears, thanking you for what you're delivering because you literally answered their prayers. That's what the home care evolution is. That's what you can do. That's how you build your business and you grow. And the best thing about it, check this out. I'm going to give you some ad-lib stuff off the cuff here, right? Because I like doing this. I'm feeling the zone. That one single shot locked espresso, whoop, it is kicking in. It's like taking pre-workout, right? So let's say your territory has 500,000 people in your market. You can do the math afterwards and break it down. 15% of the population of the United States in any market, give or take 1 or 2%, is 65 and older. That means you have 75,000 seniors for every 500,000 people. Medicare statistic, 1 in 3 seniors every year will go to the hospital. 1 in 3. So times 33%, right? We'll say 25,000 for quick, easy math. So now you got 25,000 seniors for every 500,000 people in your market that will end up in a hospital at some point this year. How many of them have 5 or more chronic conditions? You can go to Medicare.gov and look it up. It's 20%. 1 in 5 seniors suffers from 5 or more chronic conditions. That means you're going to have 5,000 people with great need. Take out the Medicaid, folks, which is 40%. That leaves you with 2,000 people. Whoops. Sorry, 5,000. You take away 40%, it leaves you at 60%, so I apologize. That's 3,000 people who have resources, who have the need, that will get care in your market if you have 500,000 people. Now, Steve, what if I only have 250,000 people? Cut that number in half. That's 1,500 people who will get care this year. What if I only have 100,000 people in my market? Well, if I have 500,000 and that gives me 3,000, right? 20% of that is still 600 patients who have the resources, who will get the care. And I can guarantee you, because I've been doing this long enough, if you only have 100,000 people in your territory, you don't have 15, 20 different competitors. You have 1, maybe 2 agencies that you're competing with to reach that 600 people. The bottom line, all 3 of you couldn't handle 600 admissions in 1 year. That's the truth, right? And a number just goes up. So if you have 1 million people, you had 6,000. The numbers don't lie. This is what I'm talking about. And you know what's crazy? The average agency last year only signed on and onboarded 60 new patients last year. 60 new, that's the national average, straight in the middle of the pack. Even a lot of the masters, I know how many people you have to onboard to do over 5 million in revenue in a year. You're talking about 120 patients, 150 patients in 1 year. That'll give you a 5 million. If you can consistently bring in 150 patients every year, you're going to be doing over $5 million in total annual revenue in no time. And that's what, 3 patients a week? It's not this crazy figure that's pie in the sky. 150 people out of how many that I just showed you who are looking for care, who are going to get care anyway. It's literally a drop in the bucket. It's working smarter, not harder. And it allows you to be able to adapt and thrive. And what does this mean for your patients? This is the best part. For those who are the target customer, when you bring in an abundance of them, it means better quality care. It means when this patient, and I know, how do I notice I did this? I did this for 7 years before I started Hurricane Marketing Enterprises, 2005 to 2012. Then June 20th of 2012 is when I started Hurricane Marketing Enterprises. My 10-year anniversary is coming up next month. I am very excited for that. I know this works because I did this. I grew my company to over $5 million. We were taking care of over 100 patients. We were billing out $116,000 the last week that I was on the job, right? I know what it's like to provide the superior care. When you have a patient who's a bedbound patient, when you have a patient who had a massive stroke, then do you know the number one fear of the elderly is not dying? The number one fear of the elderly is losing their independence and being dependent on someone else. The very job, services that we offer is people living their worst fear. But when you do this and you send in an experienced caregiver who knows how to transfer a stroke patient or somebody who had a hip replacement, I want you to think about it. If you've ever injured your hip, you know how painful that is. Could you imagine having a hip replacement, how much agony that is? It takes people months to recover, right? You have somebody who knows how to transfer somebody, that's better quality care. And when you provide better quality care, it's better outcomes. And that allows you to continue to grow, and it allows you to help more people stay at home than what we're currently doing right now. This is the evolution. I get so passionate. I really do. Because that's what's at stake here. And so what does the industry look like for the next 5 to 10 years? Well, I sure as hell hope the government is going to step up and do their part and take care of people, because I'm again, you've heard me say, I'm not happy with our government at all. I don't care who's president. I don't care who's in Congress. They're all jungle. They're all garbage. They all work for themselves and to line their pockets. Lobbyists control everything for the people. But in the meantime, for us people in this industry, we have to make the change. We have to adapt to the caregiver focused model. That's what it means. And the companies that have this caregiver focused model, because let's be real, you heard me say it, the baby boomers, they are the largest demographic in the United States, and it kind of is going down, right? It's like baby boomers are the largest, Gen X, millennials, and Gen X are comparable, and then you have Gen Z, and I think it's starting to go up, but we haven't quite reached a point where more people are dying than are being born, but we're like 1-to-1 in the United States, which means that we're running into a situation where there's not going to be enough people to take care of those with need, and that's what the next 15, 20 years looks like. And so the agencies that adapt and embrace everything that I'm saying, they're going to thrive. They're going to thrive. They're not going to take care of thousands of people unless they have multiple locations and everything else, but they're going to thrive because they're going to have the model that works. They're going to compensate people with what people are asking for. They're going to create the culture that retains people. There's so much more that goes into it, like having a 20-hour minimum and building out schedules for people and all this other stuff. If you need immediate care, having a startup fee. There's a whole bunch of stuff that goes into this whole thing. I only had so much time with you, and I'm running out of time right now as we're coming up to the top of our hour here. But the people who adapt and thrive, or people who adapt and transform their businesses, they are going to thrive because there's an abundance of need and not enough workforce. This is the evolution. This is the blueprint. It really is. And this is what I've been doing for 10 years now. And I have to say, all glory to God. I am a minister Jesus is my Lord and Savior. All glory to God that my clients follow through with what I'm saying. They're executing on all levels. And here are some of the people, from my Elite Academy who I'm going to see tomorrow when they're here in Jersey. This was us in Las Vegas back in January. This is some of the members who are thriving and executing on everything that I'm teaching you. So this stuff works. This was us 2 months ago in the Alamo in San Antonio, Texas, having a great time there. And this was us last year, a different group of folks. My Elite Academy has about 40 agencies in it now. Us at the Statue of Liberty, about 35 minutes north of my office here in New Jersey. Absolutely incredible. We're having great times, but they're executing. They're living this evolution. They're making things happen. And so my last question that I'm going to answer is, what can I do to get started? Like, all right, this is great, Steve. Yes, I'm in it. I've been listening to you for the last hour now. Totally makes sense. Thank you for all this information. I'm going to check my KPIs. What do I have to do to get started right now? Come to my conference. Come to my conference, my 10-year anniversary conference. There's only a couple of spots left. It's filling up. It's owner focused, right? It's going to be about operations, recruiting and retention, what we have to do from a sales and marketing perspective. We're going to talk about finances. We're also going to talk about preparing your business to exit, as I know a lot of you are thinking about exiting in the next couple of years. I hope you've all downloaded and received a free copy of my Home Care Evolution Quarterly magazine that came out a month ago. The second issue, which here's a picture of the cover, is going to be dropping next week in all of your inboxes via email. You can download it. But in the last issue, the first one that came out, the very last article was written by my business partner, Holt Vaughn from Tobin Left Group. And we help people exit their businesses. And they talked about how long you should actually plan for exiting your business. And he and David Tobin are going to be speaking at this conference, talking about planning your business and running your business as if you're going to sell it. Because a lot of people don't realize you should begin the preparations for exiting your business a few years in advance. That's in this article right here. You can go read it for free. Go to my website, homecareevolution.com magazine, and then you can access it and you can read it right now until the new articles come out next week. But if you decide that you want to come to this conference, as my thank you to you, anybody who purchases a full price ticket, I'm going to give you an option where you can either get my Home Care Rapid Results Kit, which gives you a closing technique, which gives you schedules for marketing, which gives you a free ticket to come to the conference, which also gives you how to create power partners. It gives you a blueprint for scaling your business to over $3 million in revenue. All this is a $2,700 product. I'm going to give this to you for free when you buy a ticket to come to the conference. And if you already have one of these, something a lot of folks don't realize, I actually created a program called the Small Business Success System, which has 6 trainings on here. And these 6 trainings are inquiry management, closing, time management, understanding your sales funnel. That's the lesson that of all of them, that's the one that I reference all of them. How to create a proper marketing plan and power partners for your entity. So you can choose either one that you want. The Small Business Success System, this is also a $1,000 plus product, or the Rapid Results is my gift to you. Thank you. When you buy a ticket and you come to my 10-year anniversary conference, you can go to my website right now, homecareevolution.com/conference, or just go to homecareevolution.com. You can find all the information about the conference. And I'll see you on June 22nd through the 24th, where I'm going to give you everything you need to blow away the competition, folks. So let me see, I have some questions here. I know I talk a lot. Great point on caregiver first. Man, Richard Bruder, you've been with me all day, buddy, all day, in every single class. We now have a new motto, caregiver first, client second. Well, it's caregivers first, and then the client results come as a byproduct. It's not that clients are second, it's caregiver first. But the outcomes that we want, which is happy clients, better services provided, elevating it, that comes as a result of caregiver first. I don't want client second. It's not client second. It's caregiver first. The result, the byproduct of that is superior service. And then last one is, what is the benchmark code again? I tried Evolution 22 and it didn't work. Try Evolution 20. Try Evolution 15. and make sure evolution is all capitalized. So evolution 22, evolution 20, evolution 15, all evolution all capitalized, the benchmark study, and that should be able to give you your information. How much is the ticket for the conference? Ticket for the conference is $9.99, so it's $1,000 for a 3-day event. And then there's options for VIP upgrades and everything else. But it's a 3-day event. This event is costing me, I hate having to charge $1,000 to come, but the event cost me $100,000 to pull it off. And so, you know, I have to charge $1,000. It's as simple as that for a $100,000 event. Between the AV, everything is astronomical right now. But the good news is if you're flying in, and this is why we have it at the airport, you fly in and you walk to the hotel right on site and you make it happen. So Medicaid reimbursement is too low, but Veterans Administration is over $30 in some zip codes. What do you think about working with the VA? I'm fine with that as long as the reimbursement is okay. The only thing that I have to say about the VA bill is I have seen a lot of folks get burned by the VA. So make sure you dot your I's, you cross your T's, and you're getting compensated. I literally had a client write off $100,000 in losses that the VA would not honor, and then they ended up never accepting a VA patient ever again. And I don't want that to happen to you. So make sure that if you do go with the VA, because and this is why I don't. This is what makes me mad about the government. I don't want to get too into it, but I've seen the government screw people. And like if you provided $100,000 worth of work for veterans, you should get that money. So you know, just make sure that you don't get screwed. Be careful with the government. That's all I'm saying. All right. I worked at the Pentagon for 2 years. I know. Good response, Bill. Good response. I think you're going to be okay. I think you're going to be okay. So, again, my friends, you know, thank you so much for your time. I hope you learned something. I hope you had some fun. I hope I opened your eyes to really seeing and embracing the changes that are coming here. You know, I put this stuff together for you. I love this. If you think this is great, and I think to Valerie Darling is one of my favorite clients, member of the Elite Academy, been working with her for like 4 or 5 years. I love her husband, Carl. They're going to be at the conference next month. Valerie had said to me that, you know what I love about you, Steve, and your events and everything else? She's like, when you own a business, you're kind of on an island. You're kind of by yourself. You can't really talk to your employees about certain things. You know, I may know a couple of agencies who are competitors, but I can't really talk to them. But when I talk to you, I can vent, I can let it out. But then not only do you give me the solutions and the know-how, but you also inspire me and let me know it's okay to be frustrated, and then you motivate me to go back and to make the change and let me know that I can do this. And then the results are I grow my business. And that's what I love about this. Like we're all in this together. And so when you come to the con, those of you who've been into my boot camps, you know what I'm talking about. When we're there, we're all family. And we share in this, and I'm training, and you're gonna leave, you're gonna get all this information, you're gonna know exactly what you have to do to change your organization, and then you're gonna go back and you're gonna be on fire, and you're just gonna light your agency up, and this is why people have staggering results with us. So I hope to see you at the conference. Like I said, we only got a couple spots left. Grab one of those. My thank you to you. Choose which products you want. You can get access to that immediately. You just pick which one, and then you can download everything. So you're not going to get a box. You're just going to be able to access it right away. That's my thank you to you. So I love you guys. I hope to see you all at the conference. It's going to be amazing. And no matter what your business is doing today, I know we can make it better. We can turn things around. If it's not going in the right direction, if you're stagnant, we can get it growing again. And if you're growing, we can get it growing even faster and smarter, so you're not killing yourself to be able to provide superior service. Thank you for your time. God bless you all. Take care of our seniors. I love you guys. Good night.